will get it, and then you'll get a copy of the recording. So the reason I call it the empowered therapist is because just like our clients who've gone through a lot of pain, suffering, or trauma, often could feel disempowered or could feel like they don't have access to choice. And I want you to feel empowered with knowledge, with confidence, with wisdom, so you can offer more to your clients. And maybe it's not more skills, maybe it's different skills, but come from a place of empowerment. Okay. The four primary goals that we're going to be looking at today is identifying your core struggles, because we all have strengths and struggles, just like our clients come in and we want to get to the core of their pain point or their struggle. We're going to look at some concepts that are needed for when we're looking at a difficult case. We're going to look at tools for transformation, trauma-informed tools, and a deeper look. I have a trauma therapist training program that's approved for CEUs. It's a certification program that I offer twice a year, and I'm happy to give you information if you would be eligible to apply. Okay, so for anyone on here, if you're feeling brave, I would love to know what brought you here. What is it that brought you to this masterclass? I had almost 400 responses on the questions, and I can tell you some of those, but I would love to hear from those of you live. What brought you here today to the class? Jared, what brought you here?
I guess I would say, just as a new clinician, every client has experienced trauma in some way, shape, or form. And so I want to show up in a way that is, sensitive to their experience and that is aware of how I'm showing up in the room, that's informed and just mindful.
You're saying like you want to have that sensitivity and like that trauma-informed nuance for new clients. Yeah. Okay, well, your clients are lucky that you're here and taking the time. Thank you for being here. Okay, let's see. How about you, Fiona? What brought you here from England?
I'm just eager to extend my knowledge with trauma-informed practice any way I can. So I'm always looking for new opportunities to talk to and be with people working in this field. I run a specialist bereavement service in a children's hospice, and we have a lot of sudden and unexpected loss for a variety of things of children. So it's a big part of our work, and we're just always looking for creative and great ways to work with our families.
Wow, such powerful work. You likely hold a lot, right? Like a lot of what is and a lot of what's to come. It's almost like holding on tight and having like a wide bandwidth for the shifts and changes. Yeah. Thank you for being here. Okay, how about you, Zlatka? What brought you here?
Sure. Hey, yeah, always looking for new tools to add to my toolbox. As much as I do the work, it's never done. It's always, there is room to grow. So that's why I'm here.
Yeah. Thank you. Thank you for being here. I think it's like that fine line between how do we keep showing up and also learning, because really, this work is just as much about us as it is about our clients, right? Like, I'm a therapist, I have a group practice, I run a training program, and I run these master classes because just as much as I love teaching, it's such good, important reminders for my own self, for the clients that I'm working with, the things that are important to have these conversations and to remind ourselves of the pieces that are important. So one of the things I want to say is that you're not alone, right? The pathway to greatness is closer than you might think. And greatness doesn't mean that you're perfect and that you're amazing and that you have everything figured out. Greatness is feeling like you're fully embodying the role that you have as you are today. We did a survey on LinkedIn. We interviewed over 300 people asking them what the hardest thing is for therapists. So one of the biggest factors was isolation. And I think the isolation factor is that, we're meant to be in this place where we hold everything confidential, which we need to, at the same time, like we're humans and our hearts get carved with the stories of our clients. And I think one of the things that's important is having community and connecting with others who are in this line of work with us and learning alongside us and having those important conversations. Okay, so one of the ways to become a great therapist. So what I would like to talk about is global and then more specific, right? So one of the things that I'm super passionate about, and clearly all of you on here are too, is trauma healing, right? Trauma healing is not like a one-off thing. It's not just like that your clients coming in, right? Like you just mentioned, Fiona, that you're part of this organization. Like we all live in communities, we all live in the world in our own little minds and bodies. That's what we'll talk about in terms of our clients' inner templates. But then there's also external templates, which is like our families, our social bubble, communities. One of the things I'm super passionate about is creating more awareness so that there's more trauma healing across the world. I know for myself, years ago, when I was like Googling things for clients or even for my own healing, when I was navigating a lot of anxiety, I was looking things up online and I couldn't find resources. I was looking up body flashbacks. I was looking up carried shame. I was trying to understand the concept of somatic memory because I used to have a lot of really bad somatic symptoms. And then I realized there wasn't much on the web. I think there is much more now. And so I started doing research, reaching out to experts, and then blogging, and then doing a lot of training. So what I have to say is that now our website gets between 78 and like 82,000 hits a month. And what I find is um, the work that I do feels meaningful when people reach out to me and say, "Hey, I read this blog. It made me realize that I don't have to go to the hospital, but I'm having a panic attack." Or, "Hey, I'm realizing I'm having repressed trauma memories coming up." Or, "Oh, I'm not crazy. This is parts work." Or this is anxiety, right? So just even, or this is what's helpful to know about my attachment. So for me, I'm like super passionate about that. If I could, I would just keep writing. And like the letters that I get from people that are just saying, "Thank you for helping me feel less alone," is powerful. And each of you in your own personal and professional lives, the more you're knowledgeable on the nuances of either trauma or psychological impact really matters. So we want to create a roadmap here for you as the therapist, for your client that you're sharing with them. Here's how we're going to guide you. And then there's the global impact I was mentioning. But the more knowledgeable that we are, the more of a bigger impact we can make in our clients' lives and in our society. So what I want to do, actually, I want to go back here for a second. If we were to talk about a core struggle, what would you say is your primary struggle being a therapist right now? Anyone brave enough to share? Like, what's your primary struggle? It could be boundaries. It could be knowing how to get. A lot of people, where I ask the questions, shared that it sometimes it's hard to stay focused on the treatment goal or knowing what the treatment goal should be. I'm curious for those of you here, like, what's your primary core struggle in being a therapist? Is it like,
So
yeah,
I
yeah.
apologize for my video. I don't know what it is. It just shows this Intel situation. So I'm turning it off. But
I like
one of
seeing your face more than I see Intel,
I
Brianna.
know, I don't know
Okay.
what's wrong with it. It just keeps doing this. And I thought I had it fixed, but it's not even, my laptop can't even see my camera, my
Okay.
laptop camera right now. I apologize.
That's okay. Tell us.
Um,
Yeah.
one of I work in substance abuse and domestic violence. I run a substance abuse prevention and domestic violence program treatment center for perpetrators. Not this whole center, just the programs. But my biggest challenge is actually recommending the number of weeks I recommend. I'm trying to be evidence-based. I'm trying to, also address other things that may come up. And I came into the program not knowing exactly why they had the number of weeks that they had. And so now my biggest struggle is just trying to recommend the most effective amount of treatment. And so, the clients are coming in and they have their assessment, and in their assessment, I find out, oh, they really are having some mental health struggles, or they are in huge denial. They're denying that they have ever experienced any trauma, and so like, in order to be able to, I don't know, I guess maybe this is a little less, what's it called, related to trauma than it is to just like trying to
Right.
figure
Like,
out how much treatment am I supposed to
yeah.
be giving these people.
Yeah. I think what I'm hearing you say is, how do I define successful? And we'll check in with a few people and dive in. But I think what I'm hearing, and you'll hear about this because I talk about framing of the session, like there's five primary components of successful treatment. If your treatment frame is not clear, then you're not going to have a successful treatment. And so if a client, I think the question would be, and you don't have to answer it right now, but maybe reflect on this, is like, what's the goal? And if one person, let's say there is a mandatory amount of weeks, I think your role or whoever you're working with would be, how do we define successful treatment? If one person's in deep denial, if after 5 weeks the walls of denial are less, then that would be success. Or if there is denial, it's like, how do we work around raising awareness of how their behaviors have impacted themselves? So raising
Okay.
or starting to notice their, unmedicated depression or bipolar and how that's creating havoc in their systems to psychoeducation. So I think I would less expect people to be healed within 5 weeks or 7
Yeah.
weeks or 12 weeks, but maybe coming up with a clear framework of what is it that we're wanting to accomplish with these clients? How are we assessing for realistic expectations? Because what you're mentioning is pretty
Yes.
complex presentation and a lot of inner fragmentation, if I would just go simple. So I think the
Okay.
expectations for yourself being clear will help you feel more successful. And success is going to look different than if it's somebody who's like down the line, like a year later in their treatment or already medicated or getting the right kind of treatment, it's going to look different. So I think part of
Okay.
that would be clarifying questions.
Yes, that helps. Thank you.
Yeah, of course. Anyone else? What's your core struggle? What are your core struggles clinically right now? Zlatka, yeah, tell us.
Yes, I have few clients, and basically they're in relationships. They're married or in partnership with somebody. And because they are just starting from the beginning, understanding their own trauma, healing from that trauma, obviously, often they're in partnership with someone who is also struggled or had trauma experience. So that trauma bonding that happens, and while they're learning about their own trauma, then they are on the receiving end of their partner being triggered. So it's that kind of dual understanding and healing, and knowing how to juggle those two in sessions. It's something, yes, that can be challenging case to case, but yeah.
Love that you share that. So basically, working with clients who, on the one hand, are like committed to healing, but then on the other hand, because they are living their lives with the skill sets that they have, are engaging in ongoing trauma bonding or got into a relationship or relationships that are the foundation is trauma bonding. And so then the question there really is like, how do we navigate? Not that you're asking this, but this is what I always think with clients who go through trauma or have um, or getting into relationships out of a wound, right? Like when I tell my clients, like, are you reaching out from a place of connection or out of a wounding, right? Like, and it depends on the capacity for them to be honest and real with themselves, and it depends on the layers of fragility. Because if somebody's very fragile and the only thing they have is their boyfriend, even if they might be in a trauma bond relationship, I might not challenge it as much because I want to bring them to a place of more stability or more relationships and resourcefulness, either in our relationship or in their life before I challenge the relationship, right? Or if it's a very toxic trauma bond, I might start challenging the relationship if I think it's doing more harm than good. But I will expect them to feel a little bit more emotionally chaotic because it's going to trigger their abandonment wounding or right their attachment wounding. So I think
Absolutely.
yeah, go on.
Absolutely. And just to chime in, for example, right now I have a case when somebody, this female client is married to a husband and have kids, whatever, for many years. And the challenge here is that she has very limited support system that it's resourceful, useful, and helpful. I'm not challenging her relationship with her husband, but she is being triggered, and she herself is starting to challenge a lot of things that she was taking for face value before. So while she's learning the basics of her own trauma, she is also challenging that with her own relationship. So it's happening simultaneously. Anyway.
I love what you're saying. I think that we all, like, we'll talk about the case in a minute. Have any of you on here seen that? Do you see that with your clients? I know we have a few new faces. Maribel, Nechama, Sam, Rachel, Jeffrey, Jarden, Colleen. Any of you want to just say hello or chime in if you resonate with this?
Yeah, all of this makes a lot of sense to me. So,
Yeah. So you see
yeah.
this as well with your clients. You're saying like,
Yeah, particularly like, some of the trauma bonding is inherent though. I mean, they're gonna like, I don't see trauma bonding as a negative. It's more about getting them to have more self-awareness and kind of insight is to kind of kind of their self-differentiation process, simultaneously healing and beginning to kind of be less reactive. right? And so, I mean, that's really disruption and repair. I mean, I think, you know, um, I, I don't know if it's realistic to think someone's gonna heal to the point that all of their relationships, they're gonna, people are gonna find people at the same level of healing that they're at, right? And so developmentally, so they're gonna find their mirror opposite. It's more about, can they own their stuff and still have enough in common with the other person that the relationship is meaningful, that it's not so stacked on a reenactment, a replication of just what feels familiar to them in somatically, that they're attracted to them both somatically. Their resonance, is because of their level of trauma and emotional and psychological development. Does that make sense?
I love what you said. I love, Jeffrey, like what you said, because Zlatka, does this make sense for you? Does it resonate? Yeah.
Absolutely. Yeah. The
Yeah.
whole, yeah,
Yeah,
makes
so I don't
sense.
see it, it's not a negative. It's like, but they, that they need to heal themselves and not the other person, and so not to control the other person, but to recognize like that the person's kind of maybe showing a mirror to themselves around their own wounding, and that to kind of do that parts work around their own inner child, or their own, that it gets polarized where their one person will become the externalization of that person's harsh inner critic, and if the person then has to have insight into like not reenacting those wounded scripts. Does that make sense?
Yeah, I love what you're saying, Jeffrey, because like I think a lot of times clients with trauma will share, like, should I wait till I'm fully healed or could I get into a relationship? And I'm always just like, I don't think it's one or the other, unless somebody is obviously in a very unstable place or needs to first like stabilize just for basic functioning. And it's just a relationship would just really throw them over. Exactly what you said. I think the thing that resonates the most, I mean, all of what you shared is very eloquent, is how it's not a negative, it just is. So we
Right.
have these right templates and dances we get into. I think like what you're saying, Zlatska, and we'll dive more in, is I think as we help our clients develop language around what's happening, and like what Jeffrey just said, identify the parts or know what's going on inside, as they become a little bit more connected to self energy and are able to like
Right.
have less reactivity, I think there will be more clarity around the relationship. Some relationships will level up. Like I tell clients, like, let's not work so hard on focusing about the other. Let's really look at inside, like kind of what you said about a mirror. Sometimes relationships will level up and sometimes they'll self-select out. It doesn't mean every relationship ends. Sometimes the relationship kind of the dynamic shifts. And then the client or both of them decide, okay, what's working or what's not working. But already there's a lot more emotional capacity and bandwidth to then make those whatever tweaks might be needed or decisions. But I think as a therapist, Latka, I get how like maybe transference or countertransference. I know for my own self, there's times where I'll notice, I don't know if this is coming up, like clients are in a relationship and like sometime later, I feel like, wow, one person's really growing or outgrowing the relationship. And I think that work might be really helping to focus back on self energy because maybe their partner's bringing them down, or there's a lot of triggers in the relationship. But that really, right, is opportunity either to engage in healing or to notice like what's coming up in this relationship. Yeah. Okay. Anyone else want to share any specific core struggle they have before we go into case example? See some new faces. Okay. So what we're gonna go into is examining a case. This is a case I've examined a few times. The goal of me examining this case, his name is Charlie, is really to give you context of complexities that are going on. One of the things I find most helpful for working with clients who have trauma, which is almost all of our clients, is that there's obviously always like an external layer, like there's external and then there's internal, almost like explicit communication and implicit communication. And I want to just talk about what's going on with the client because it sounds like a lot of you are already knowledgeable, but just the more awareness we have, the more implicit confidence and security our clients feel in the room with us, right? It's like when I can pick up on nuances or pick up on what's going on, the client can feel more secure. So, and I do want to say one thing, although maybe this is like redundant, but when we talk about being trauma informed, trauma-informed, people think trauma-informed means trauma therapy. Trauma-informed just means not doing any harm. And it might not sound like a very sophisticated line, but the primary thing that we want for being trauma-informed is not to re-traumatize our clients. Then we want to be obviously trauma educated. Now, before I go into a clinical case, I do want to talk about one of the things that's really important. So I think when it comes to navigating clients who have complex systems or, trauma, anxiety, relationship dynamics, we want to be able to navigate complexities. Sometimes clients will say to me, I'm a really complicated client, or my treatment's so complicated. And what I usually say to them is, I don't really know that you're so complicated. I think that you might have some layers of complexity or blockages or defenses around what's going on. And really, my job is to help identify the roadblocks and help us move past them. And that's why I put a picture right here, because a lot of times, like when a client says something, or even when therapists who reach out to me will ask for consult, the therapy is pretty straight cut, right? One of my mentors says how like trauma therapy is not treating trauma is not so difficult. It's treating the relationship dynamics, the attachment wounds, the fear, right? Providing a felt sense of safety. That's really what we want to work on, right? Or personality traits. If I have become a very anxious person, or if I'm very graspy, or if I have like a lot of anger in my behavior to function, that's going to take time to soften more than processing the specific memory of either sexual abuse or neglect. Of course, we could work on that, but side by side with doing that core work, we also want to look at the blockages, the fears, the beliefs, the people that were or weren't there along the way, and our role in that. Now, the reason I put here an image of myself giving a presentation, and it says we want to help our clients get out of threat brain. I gave a presentation at LaGuardia Terminal B. They specifically are right there an airport, and they recently, their staff were navigating a lot of transition. And they said, Esther, can you help us with our staff who are navigating transition? And I said, okay, but I'm not going to help them hustle harder. I want to help them be able to navigate their nervous systems, because if they can get out of threat brain, and they could get into and not in and know what safe brain is, we could get into drive brain. And I think about this a lot in terms of our clients, is like when our client is in threat brain, right? You see right here, which is fight, flight, or freeze. Then this is how they're operating in their life. And this is also sometimes how they're operating in therapy. They're either in this fight place where they're constantly fighting, right? In the hyperarousal, like always like on defense, right? Rushing, doing. Flight is kind of like they're running away, shutting down, dissociating, or freeze is kind of where they freeze and they almost have panic attacks and they feel like they are stuck, right? And so specifically for this business, actually, they were like, are you going to help us be more productive? I said, yeah, actually, the slower you move, the farther you're going to get. And so on the right side is a safe brain, right? For somebody to relate, to reflect, to think, have complex thinking. And drive brain is be able to obviously accomplish. And I think about this with clients, especially those who are like, how are you going to help me? What are we doing? And I say, my primary goal is to help your brain and your body notice when you're in threat brain, right? Kind of what you mentioned in like trauma bonding or even in relationships. Notice when you're in threat brain. Some people are always living in threat brain. Notice when the body is feeling threat, and then see what steps we could take to help you get into obviously safe brain or drive brain. Now, it's not always so fancy, but I think like sometimes with clients, they want to know how are we helping? And to me, more capacity to notice when they're dysregulated is growth, and also more ability to be in safe brain. Now, so there's like external functioning where there's less of that activation, and then internally for the deeper work, which I'll talk about more soon, with clients who say, well, I have a hard time functioning, and also I have all this deep trauma stuff that comes up. I say, okay, so we want to improve your daily functioning or more capacity to function. And I also want to do some trauma processing so that you're not constantly having to backpedal out of this threat brain and into safe brain. If we do the deeper work, we'll soften that so you'll be less frequently in the threat brain, right? So even just educating them on, if you're living in survival, we want to give you some tools. We're obviously going to also do the inner work so that you don't constantly go there, but acknowledging both. Okay, so some of the roadblocks that I would say, right? Expect the road bumps for a smoother ride. I think like the blockages and learning how to work with blockages is probably what's allowed me to develop good connections with clients more than anything else. Because their systems, I guess, like even one of you just said, like their systems don't feel as confusing to them or to us when who they are and the many parts of them make more sense. So I guess one of the things I'm curious if any of you have worked with like phobic avoidance. That's one of the primary inner conflicts that I've seen. Have any of
Yes.
you? Yeah, Jeffrey, I feel like you for sure know that. You know that whole
Yeah.
part.
So I have a guy who does a lot of isolation,
Yeah.
and it's his coping styles is like, it's like collapse. He's in kind of a state of collapse and then fawning. So no, he grew up in a very, very violent home, a lot of violence, and just him learning to be there for himself. But he's very isolated, and he did really well in college. He was in a I don't know what you call it, classical dance club, and
Mhm.
was present, and just the movement,
Mm.
just him being able to move was very helpful for him. And now he doesn't do anything. He doesn't work out, he doesn't, and I mean, there's some financial stuff, but not enough. And I just keep making suggestions around, you need to move. And I don't know, I don't know, he's doing a lot of mindfulness and meditation and soothing his inner critic, but his self-agency around, moving, like, he's just pretty depressed. He just goes to work, he works at home, he's an illustrator, and,
Right.
and
Right.
he just does that and walks his dogs, and that's it. And I'm just trying him to kind of create more community, but I'm beginning to feel like a broken record.
Right. Right. I hear you. Well, first of all, thank you for sharing. First of all, I think the fact that he's consistently showing up to you means that he values the connection and there must be some
Right.
like security in the relationship with you. But I am hearing what you want, which is what we all want for our clients is like we want them to use us as a tool so they could then replicate these connections or the connection with us outside. And it seems like he's stuck in this like collapse, right? Where it's almost like he's not interacting with his social engagement system, and
Right.
you said the home was very violent. So I wonder if I love what you said about movement because I do think like learning number one, just how to physiologically be in the body
Right.
is like a skill. I have some clients who are like, Esther, like my friends want to know all the cool techniques you do. And like all I'm telling them is that I'm learning how to be in my body. I'm like, hello, learning how to be without danger or threat is foundational to clients who basically have constant either flashbacks or fears. But with your client, it sounds like there's something either around movement and slash or around connection. I wonder if there's this
Connection.
overcoupling between like connection and threat or connection and danger.
Right. There is.
So it's almost like instead of like Dr. Becky Kennedy, I love her. She talks about like parenting with children who are like challenging. She always says like if you set a boundary or you make a recommendation you can't pull through on, rather don't do it. Like do it when you have the energy and capacity to help your child. So I wonder if with this client, if there's a way for you, this is just a thought and then we'll go into this
Right.
more, but I'm happy to chat with you more about it another time. But I wonder if there's a way for you almost to work with his protective system, like what's good about not socializing. Like there's something good for him. I don't know if it's conscious or
I think
unconscious.
for him,
Yeah.
it's a fear of being judged. So he's one of the things that's really hard for him is that he's an identical twin, and his twin is doing better than him. Although his twin is in therapy for a lot of anxiety, his it's almost like his twin is his alter ego. Like he watched his twin brother say the things that he never could say. So he ends up feeling defective. Like that's a core theme, is that he feels
Right.
defective.
So
And
what
then
I'm hearing
one
is,
other thing that
yeah,
is really
yeah.
important is that when he was in the womb, his brother's heel was in his chest, and it's left a permanent. Now he's 36. He's got a permanent hollow in his chest, and so he doesn't like taking his shirt off at the beach because his chest is concave.
Wow. So it's almost like impact by his brother, on a physical level and mental,
That
right?
he's not his brother and that he's the
Right.
defective one.
Right. I think with this client, and then I'm going to go through the rest of these. I think with this client, and you can like think on this, is like, I think really the piece, what I'm hearing is there's a whole team of critics or protective parts that are just like, I'm
Right.
not this, I'm not that. What I would do with that client is almost like, shh, there's a whole system that has a whole peanut gallery of a lot of thoughts and feelings. Like, yes, maybe his brother is XYZ. Let's say his name is Charlie. Let's come back to Charlie. And I think what I'm hearing is I wonder if Charlie has ever learned to somatically enact what he wished he was able to say. I know his brother is almost like it's over, like there is this noticing his brother could or couldn't do. But what I'm hearing is almost like I almost wouldn't even look at the socialization, but I would look at who does he need to be to feel a little bit more okay socializing. And to me, it sounds like, is there a way for him to develop? Not, it's not a question to ask him, but just for you to think about a little bit more of a whole sense of self. I think about this with clients, right? They're in toxic relationships, or have a lot of social anxiety, or have a lot of like they have avoidant tendencies, because we're talking about phobic avoidance. What is it that you need to know, or what is it that we need to work on so you can feel a little bit more secure to be able to get out there and try? Because it is a risk. The risk is someone will like me or they will reject me.
Right.
But we need a little bit more capacity. Sometimes, I don't know specific here, I'm not going to go more into it, but if he never really got to either say what he needed to say or defend against the person that where there was a lot of physical violence, or he never got to process the fear that was trapped in his body, and so he's just in collapse, I think that might be a place to start. So you're somatically helping to move around some of the energy internally.
Right.
Does that make sense? So then, even because you have a great relationship with him, so instead of giving him advice, I almost wonder if you can challenge him with his internal template, and then see if he could be receptive to that and maybe have a different kind of energy to maybe do the things that you both want, he wants to do and you want to do, but haven't been able to get to yet.
Right. Okay.
Thinking on that. Okay, so phobic avoidance, that's one, is like people who are chronically avoidant. The other piece about phobic avoidance that I think about is sometimes people talk about doing inner child work. And when somebody says like, oh, could you see your inner little wounded child and have so much compassion for her? Or tell her like, wow, I'm so sorry you were alone, or whatever the generic loving comments are. A lot of times clients who've gone through trauma or neglect don't have that voice, or they might have a voice inside of them that has this phobic avoidance, which is almost like, ew, I don't want to love on her. Oh, she was so annoying, right? So sometimes, like with clients who have like a lack of an inner compassionate voice or an inner template of comfort or support, asking our clients to self-soothe or hold themselves is actually like um, it could be really shameful for them. And so sometimes when I have a client who has a lot of big emotions around either like their fears or their self-belief, I'll work on developing some kind of compassionate voice, either my words where I might say, okay, so just notice what happens as I say these words, to the 10-year-old you, or to the part of you right now that's struggling as a parent. It must be so hard to have to try to figure this all out with no one who's taught you how to do it right. So sometimes I'll kind of like, I think just like knowing when our clients have a phobic avoidance of their inner experience, either going inward or when we're asking them to be compassionate. And I've had clients say to me, what, you're going to tell me to be loving to myself? And I'm like, no, I don't even know if you have a part of you that wants to love yourself, right? Like, isn't that my job or somebody else's job? I'm going to give the job maybe down the road to you, but not right now. So I think even just like taking that pressure off of them. The other thing is the inner conflict, which a lot of people spoke about. Who shared their input, is like a lot of times when we have clients, and you might have this actually, Jeffrey, with your client, and a lot of our clients, is there's two different parts. There's one part that wants healing. Healing doesn't just mean, okay, make me feel better. It's looking at the pain, looking at my part in the issue, right? Or what was her name? Brianna, you were talking about people who engaged in perpetrator kind of behaviors, right? Or attacking. And so it's almost like one part of me wants to do the healing, but it's also, there's another part of me that's either afraid of the pain or the losses I'm going to have. So if I'm used to being someone who's either always angry, or if I'm used to being the client who's always very chronically in crises, if I heal, am I going to lose that? If I stop being angry, who am I as a person? Right? Or as I get healthy, almost like what you said, Zlatka, if I get healthy, am I going to lose this marriage or this relationship? I'm scared. So a lot of times there's a conflict when we're doing work. It's not just like, oh, we're working with one part. We're working with a few different parts in the room. And even just noticing like, wow, I wonder if there's different opinions about our work here. This other concept is a somatic term called overcoupling. So overcoupling means when there's like a concept, but it gets like associated almost like Velcro to something else. So someone might associate touch with violation, right? Like if somebody comes in, a client of mine came in and said, I really can't, when my husband comes to me in a sexual way, I get so triggered. And so just the concept of touch equals violation to her. It doesn't equal affection and love, right? So sometimes even just knowing the concept of, wow, so something about somebody coming close to you feels like and wanting to touch you feels like it automatically jumps in, you're going to hurt me without my permission. Even though like, in the global world, touch can be affection and just gentle touch, huh? But your body almost has this overcoupling. So even just dropping some psychoeducation about what's going on for clients, and then obviously you can work with that. We sometimes have, right, a client who has a part that's hypercritical or tracking. Are we getting better? I've been here for 2 sessions. Why am I not better yet? What happened? Where are we going? Right. And we'll talk about coming up with a roadmap, but like sometimes I have a client and clients come in and I'll be like, I know you have Judge Judy, or I know you have, the treatment tracker sitting here in the side of the room. I'm going to talk to you, but could you give me a minute to try to do my job? Because or else you keep, stirring the soup and I haven't even put the spices in yet. So it doesn't taste good. Then there's like the going too slow or going too fast. Sometimes we might go too slowly because we're afraid of overwhelming our client, or we're not sure what we're doing, or we go too fast, right? And that could trigger them. So we have to try to find the pace. On my website, actually, I have a download called the Free Trauma Toolkit. And in the toolkit, I have like a few page document that says that's called pacing. And there's literally a picture of the brakes and the gas pedal. And I encourage you to print it and use it with your clients. And it's literally the concept of like, how do we know if we're going too quick? And how do you slow down? Just somatic symptoms. How do we know if we're going just right and we keep going? Babette Rothschild always says the only way to work with clients is first to make sure they know how to slow down, right? To say stop, or this is too much. Okay, undiagnosed OCD. This is something I've been talking about so much with people in my consultation groups that I give consult and in my own group practice. How often there is clients with trauma who will have obsessive thoughts and they'll loop. And there's a big difference between having a flashback or an intrusion based on a flashback of, oh, I keep seeing the face of my auntie who used to yell at me again and again, and that's why I can never speak up in school or at work or in my relationship, to I have this obsessive intrusive thought of whatever form of OCD it is, if it's harm OCD, sexual identification OCD. So being able, right, contamination OCD, what I've done is I've gotten advanced training and being able to help clients and even clinicians is like, sometimes our client is having an OCD loop of, I don't know if I love my partner. Do I love my partner? Do I not love my partner? And it's almost like a control thing. And when a client has undiagnosed OCD, I will apply more of Dr. Grayson's ERP. Like, let's come up with a loop of, when I think about going to my wife, I wonder, do I love her? Do I not love her? And instead of reassuring myself, I'm going to decide that for this moment, I'm going to be present with her because I want to choose to be in this relationship for right now, right? Because essentially, like knowing how to separate what's a trauma obsession to an OCD obsession, I think is very powerful. So I think that's just a piece to look out for. Shame, we'll talk about soon, but I mean, I talk a lot about this in my trauma training, the difference between working with toxic shame and healthy shame. I had a client I worked with for a while, and after a year, she didn't have any of her trauma symptoms that were impacting her very high levels of anxiety and dissociation. She worked with me for another year, and she said, it's so weird. Like, I feel almost better this last year than the year before. And I said, because do you know what we were working on? We were working on shame. She needed to resolve some of the triggers and the flashbacks, but the next year was unburdening herself. She was walking around with so much shame around the relationship choices she made, the dynamics, the people pleasing, the living out of fear. And it was like really working on these implicit beliefs and these voices in her head where she was carrying a lot of shame, which impacted her life. So, okay. The other piece is looking at the lack of support. Sometimes with clients, they really need more support. And sometimes there's a lack of skills training for the therapist that we want to look at. Like there were times that I felt like I was doing good work with a client, but I really needed more because I was an okay therapist, but I needed to do advanced training, get advanced consult, and being able to get the right kind of support really helped me do better work. Here, I'm just going to show you some pictures. So From Sandra Paulson, she talks also about the concept of dissociation. I just want to explain to you that when we work with clients with trauma, I think there's a few things that are important to know. There's 3 parts of the brain. In my trauma training and consultation, I teach you how to do this with your clients, but just the concept of with all of us brains, there's 3 layers, right? There's the primary, secondary, and tertiary. Here are prime emotions for ourselves as people, as babies, and then later on in life. And these core emotions are play, panic, fear, whatever. Not going through all of them, but when the primary emotions are expressed with the right kind of support, the client develops trust, empathy, and object relations. When it is ignored or shamed, what you're going to see then right here, you're going to see people who have a hard time with relationships and a hard time with regulation. When it is supported, almost Jeffrey, you and your client, then we're going to have as mentalization, the ability to think about someone else, and mindfulness. I do this exercise a lot with clients in our first session or a few sessions in, depending where they're at. If they're very judgmental about their struggle, and I bring it down to the basics. Do you have a brain? Do I have a brain? Okay, let's go basics about what's going on here. And what are the core primary emotions, or right here, like Sandra Paulson talks about this, but it's Pink Steps talks about the brain, how there are these primary affective circuits, right? And if, let's say, there is a seeking circuit that was shut down or a fear circuit that was ignored, it's going to wreak havoc. And we really want to go back to the basics. So I just give them the basics, and then obviously I link it up to our treatment. Here's an image of Sandra Paulson. She talks about, like, there's clients, like what I said earlier, there might be parts that are, have defenses. I don't want to look at the trauma. And then there's other parts that have a need and a want to heal. And the goal, like she has these 2 little parts on the right, are kind of holding hand with each other. The goal is to help, like, inner parts be able to befriend each other and do healing. Okay. Charlie. So I'm going to talk briefly about Charlie, and then I'm going to talk about the basic pillars. So Charlie was a client of mine, 45 years old, externally successful, right? In terms of his life. I do want to say something when I talk about this case. All of our clients are so different. So if you have a client who needs, like, the basics of, like, food and shelter, and they're struggling with basic emotion regulation, like, the primary needs are going to look very different. Okay. Maybe down the line, once they have that, or they're in a chaotic relationship, or they are really just wanting to develop emotional vocabulary and you're just developing language with them, like, that's okay. I'm just giving one example. There's many. So Charlie was 45, very high functioning, worked a lot, came in because his wife said that he's emotionally absent, and she was very upset. She felt very lonely. Basically, he came in and he said, I don't know why she said that, but I also, I do notice I get very angry at times. So my wife needs emotional support and I'm feeling overwhelmed. Not that I yell, but I kind of get very tense and I shut down. And even at work recently, I'm noticing that I get angry. Like I'm sometimes very irritable with my employees. He also said that his wife said, and he was in denial about this, but he had a disconnect from his 2 boys. He had 2 young boys that didn't enjoy spending time with him, and he didn't know why. And he did say that he had some somatic back pain. Okay, so there was some back pain in his body. Now, as I worked with him, I'm just going to show you for a minute from my trauma training. As I worked with him, and I'm going to share the screen again in a minute, I was thinking about the concept, and we work with clients. What we think about is, what are the primary areas of pain that our client is needing to work on, and what should be our primary goal, right? I'll show this to you in a minute, but basically you often think about, is this a client who needs to do work on boundaries? Is this a client that needs to do work on attachment? Is this a client that has shock trauma or developmental trauma, right? You want to think boundaries, attachment, which is secure relationship, shock trauma, which is a single incident trauma like rape, physical abuse, or developmental trauma, which is an ongoing feeling of, like, loss, pain, neglect. I just want to show you what with Charlie, although the fact is that I'm just going to pull up the boundaries exercise. Although the fact was that he was feeling disconnect, and naturally I would have thought about the fact that I should work with him on attachment and maybe developing more connection, what I realized was that it wasn't an attachment session that he needed. He needed a boundary session, because he was the man that needed to feel safe and secure and whole as a person who was individuated from his wife in order to be able to connect with her. Okay, do you guys see this video, the boundary exercise? Yeah? Okay, so I'm going to show you for a snippet of a video that I teach in my trauma training, because What happened was, is as I got to know Charlie, what I heard was that when he was younger, dad was absent a lot emotionally and physically. Mom had huge emotions, and she would put those emotions onto Charlie, and he felt like they were permeable boundaries, like he didn't really have a sense of self. So all of her emotions were dumped onto him. And what happened was, is he had a lot of anger at his dad, couldn't express it, and just felt sorry and sad and tried to caretake for mom. Now married many years later, his wife came with emotions, and he felt flooded with her emotions and felt like he was, shriveling back up to being a little boy. And she would say, Charlie, you're here, I'm here, we're talking. And he was like, I don't understand, I'm here. But what she was saying was like, you're physically here, but honestly, I feel like you're gone. Because he was there, but he was hollow because internally, emotionally, he would run away because his child state was being activated. So we needed to help him realize two things. One is that there's an adult Charlie in a relationship with his wife. And then two, we needed to help his inner child, who was very sad and angry about the emotional burdens that he carried of his mother, to process some of that pain. And one of the ways we did that, we had to go very slow because I needed to gain some trust, was I first told him that there's this concept called boundaries exercise. It's physical boundaries and emotional boundaries. And basically, this exercise, I'll play this for a minute. Okay. I have a client walk towards me 3 times. I'm going to play this for you so you get to see. And I tell the client, I'm going to start walking, okay? When you feel like I'm getting too close or it's not comfortable, you're going to say, stop. And just notice what happens in your mind and your body before you say stop, or when you say stop, and how I listen to that request, okay? So here I am. I'm walking far away. I take a few steps away from the client, and I just say, I'm going to walk really slowly, okay? So I'm walking really slowly, and I just start walking towards them. So walk towards them. Client. Then the client says, the first thing that they would say to me if I'm getting too close is stop. And when they say the word stop, I stop right away. Okay? And then I ask them, just check inside. What let you know that I should stop right here? We want to help them develop body cues and sensory cues of what lets them know what's comfortable, what's not comfortable. Some clients want us to come even closer, and they might not know when to say stop. And then we have to teach them social comfort, too much closeness, too little closeness, right? So I did this sample with him. It's a 3-step somatic exercise where the first is I wanted him to realize that he can develop boundaries with me in our work. And then I wanted to embody that for him with his relationship with his wife. And then we did some somatic processing around his wishing he was able to say stop around the emotions around his mom. This is a 3-step exercise where you have the client just so that they could orient to like the power that they have inside of them. You walk towards them and you slowly walk towards them, and then they say stop. The second time you walk towards them and then you say, when you want me to stop, put your hands up. And the third time I'm going to walk towards you, and what you're going to do is that you're going to say stop and put your hands up at the same time. So sometimes with clients, like with him, he needed to know that he was able to develop very secure boundaries with me and also in his life before I was able to challenge him to do some kind of deeper attachment work with his essentially inner child. Here's some other boundary work where I'll use a rope, and I have people kind of write their beliefs, a circle around themselves, around the people in their life, where they feel like they can set boundaries. So there's an individuation between them and other people. But with Charlie, what I want to say is that we needed to work on boundaries that he never got to set because he was acting out of, right? There were these basic emotional needs from his core self, and there was a very sad, angry inner child. And so he was getting triggered a lot. And so as we did the work internally, what we did, like I just said here, there's 4 primary pieces you want to look at is it boundary session, attachment, shock trauma, or developmental trauma. Now, sometimes it's a few. Right? There was an element of attachment in his work, but if I went to try to be a maternal mother figure or did an attachment intervention with him prematurely before the boundaries, I would have lost him because he first needed to feel like he has a self and he could separate between me and him. Okay? And I think with any kind of client, they need to know that there is a boundary for themselves, if it's energetic, emotional, sexual, physical, and their relationships. As we did this work and as he tapped into his young inner Charlie, because he was laughing, he's like, I came to talk about my wife, not about my inner world. And I said, I know, but let's see if we can help make a shift because our inner world impacts our outer. His inner child became a lot happier. And what was interesting is he came in and he said, my boys actually want to spend time with me more. And I said, I'm so curious. Like when you ask them why now they want to spend time with daddy, he's like, they said that I'm more enjoyable. What shifted was that he was less irritated and angry. He still had times that he got triggered and frustrated. Obviously, this was over a period of time. But because we worked on his inner triggers and aggravation internally, he was able to be more present with his relationship. So I think it's important to sometimes know, like, what does the client need? What are we working on internally or externally? Now, the 5 pillars of trauma work I think are really important, and we're going to go through them. 1 is foundations to trauma work. 2 is the life and the skills of a therapist. 3 is framing sessions, like we were talking about. 4 is treatment targets that make sense. And 5 is tracking success. Okay. So the first goal for trauma pillars is the backdrop of your why, your how, and your what. Right? Like, why are you a therapist? Almost all of us either were in a role to caretake for someone or had to be our own caretakers. And so there's something that pulls us to this field, right? In my trauma training, a lot of what I talk about is let's define our why. There needs to be a sense of purpose and meaning for ourselves so that we're not just in the field, but we stay in the field, right? There's a sense of meaning in it for us. Your how, right? What are your skills? How are you doing it? And your what? What are you doing? What's your role? And specifically, I would say things that to hold in mind is the 3 questions that our clients ask us without even actually asking is, am I safe here? Clarity, what are we doing and where are we going? That's why I was saying earlier, like defining what our treatment goal is. If somebody's coming in for something, somebody says, I want to end my relationship and be in a new loving relationship within 3 months, I might say, okay, I can't do that to you in a responsible way because we're going to make a bigger mess than a smaller mess. What I could do is start helping to help you regulate your nervous system and start making choices to feel stronger. And we can work on having a more rich and healthy relationship. We'll make decisions about your relationship later down the road. But sometimes even just thinning out or getting clear on your goal and where you're going. And autonomy, the client is asking, does my voice matter? So in therapy, a lot of times we'll have clients, I'll say like, do you want to meet at this time or this time? Or which seat feels more comfortable for you? Or how close or far, right? And the other piece about the rule of 3s that a lot of experts in trauma talk about, Vanderhart, Steele, is the way that we split our sessions is by 3s. A third of settling in. Either you want to meditate, just connect in, how they are. 2/3 is processing. This could be if you're doing trauma processing, parts work, somatic, or even just the media emotional content. And the last third is wrapping up. I remember once doing amazing sessions with some of my clients, specifically one, and my client felt real relief, but she wasn't making the shifts that I thought she would. And I spoke to my consultant and she said to me, okay, how are you doing a wrap up? Are you allowing her to marinate in the shift, notice the work, embody it, digest it, see what it's like? Imagine using that skill or that shift in behavior in her real life. And I said, no. So she's like, right. With the concept of memory reconsolidation, there needs to be a certain level of time that you're allowing the brain and the body actually to digest the session and hold it so that it can actually make a shift. And so if we don't pace the work properly, our clients are not going to make the shifts needed. Right? So I had to learn how to really help the client process it, own it, practice it, do less work, and allow her to embody it more. 2 is the life and the skills of a trauma therapist. You're the container for you, right? We have to do our own work and get consult. This is one of the fields that, like, essentially we are the vessel, right? So obviously it's not that we have to heal them, but our own healing work, our own awareness is essentially what shifts and what allows our clients to heal through us, right? It's like we're just like a vessel that we're allowing them to heal through. So it's important to get good consult. I know for myself, getting my own therapy and getting my own expert consultation has been a game changer. Having a good mentor in my corner. It's important to be, right, a container for your clients. Special gloves, like you want to be holding them gently but firmly. And you want to be modeling behaviors and life skills, right? Like they're watching you because you're a template creator. So it's almost like, what are the behaviors that you're engaging in that you're helping clients with? And it's important, like the way that we interact, our body language, the way that we feel, the way that we engage, the way that we express frustration and happiness. The third is framing sessions, the secret sauce. So kind of just like here, like if there's a picture that has a frame, it holds it, right? If there's a sauce, sometimes it's like, why does something taste so good? It's there's a sauce. And Sandra Paulson here shows how, there's clients, if you don't properly have a good treatment frame, there's swirling, there's premature trauma work, boundary violations, projections, therapist trends, projective identification. So framing the session is being very clear on what are we working on today? What's our agreement? That's why it's so important to have good services agreement, to define the finances, to talk about structure, timing. What's our goal? For clients who come very late or end very late, right? We need to talk about boundaries. Clients who are ambivalent, disrespectful, stepping on boundaries. If you're not having good boundaries, you want to look at that, right? So we want to name, like I sometimes have therapists consult with me and I'll say, well, you're asking about a processing session, but with good therapy, there's framing sessions and there's processing sessions, right? And this person was saying, oh yeah, my client's coming late and she has an outstanding financial bill. And I say, okay, well, then we have to talk about the frame, because if you try to do processing around her difficulties with boundaries in her life, but she's, bleeding out those boundaries in your therapy work, you're avoiding that, right? Or I had a client that had a hard time leaving session on time. And essentially, the next session, I said to her, we're going to have to talk about what's happening in session and why it's so hard to end on time or to wrap up. And she was like, no, I want to work on blah, blah, blah about my parents. And I said, okay, I know you want to work on that, but the only way that I could work with you in a way that feels respectful to me and to you is if we also look at making sure that we could start session on time, end it on time, and do really good therapy work. What happened to be was that this client had an inner child state that she was bringing into session. And although we did some work on making sure that her adult self was taking this inner child state that was very young along with her, what happened was is that that part of her really didn't want to take care of her, and it almost felt like what she described, that she was leaving a 4-year-old in my office and wandering out with it, right? And she was upset at me for ending session like that. And so just coming back to the frame of like, okay, what do we need to be able to end session on time? Is there any part of you that's not gently being tucked away, right? That's more working with dissociation and dissociative disorders or even complex trauma. What we needed to do is let's look at the frame, because if we're skipping over something that's not working, we might be missing the whole point. We did really great work on helping her system better take care of herself, me better taking care of her, and then we were able to get back into the processing. But it was kind of connected, her sharing what's going on, right? And also when we have a good treatment frame, then we're also able to retain our energy instead of feeling depleted in the work, right? When we're not sure where we're going or what we're doing, then we'll feel more tired. 4 is treatment targets that make sense, right? We want to come up with treatment plan or goals that make sense for your client for the here and now and for the future. And our clients are often thinking, do you see me, who I am? Do you see my life and my suffering? And do you see my short-term suffering and my long-term suffering? Because sometimes the client will have like a lot of long-term suffering, but they come in with a crises of the week. And sometimes it's like, I want to discern like, okay, do we tend to the crises of the week? Is it something that they need to do? Or is there this unconscious pattern of crises is how they live? And I'd rather work with this part of them that believes only if I live in this constant state of crises, will I actually get attention or feel safe? And so our clinical nuance will help us decipher what our treatment goals are going to be, right? And so with confidence, like there are clients where I'll say, hey, listen, I know, you're coming in and talking about blank. I'd like us to continue working on this specific treatment target because as we have, or on this feeling of aloneness, because as we have, I notice you have more capacity to manage the weekends and maybe even make better relationships. Or I know you're talking about your parenting struggle with your kids and you want to be doing some more EMDR processing around whatever. I actually want to work on some basic behavioral tools, emotional regulation tools so you can better be present with your kids. Then we're going to come back to your own childhood trauma. So I think it's our own clinical nuance of knowing how we're talking with our clients and identifying good treatment goals. And then the questions that clients are always thinking that we need to answer before they ask is, can you help me? How can you help me? And will you hold my hand? They really need to know that they can feel secure with you, right? And there's many ways to say I'm with you, right? Like with our consistency, with our communication, boundaries is what allows them to know I'm not just with you now, I want to work with you long term. And 5 is tracking success. Dr. Scott Miller did this research on the difference between therapists who have clients that are thrilled with their work and clients who stay in therapy and reach their treatment. And he says that the clinicians that have 65% happier clients are those therapists who ask for feedback. And feedback is uncomfortable. Sometimes asking for feedback makes us look at areas where we're disappointing them. Are we good enough? Are we not? But what clients feel like, especially think about attachment, is if I can have a therapist who checks in and say, hey, I want to check in. How's this therapy going for you? What would you like more of? What about therapy are you appreciating? What would you like less of? You don't have to do it at the end of every session, but just an honest and real feedback. And obviously, when you're confident, they'll feel clearer. Like if you can say, I have a pretty good sense of where we're going clinically, but I also want to check in on you. Then one, and I've had clients say, wait, are you sure? And I'll be like, yeah, nothing you can say will insult me. I'm actually just here to support you. And this is your work. Right. So when they know that they don't have to caretake for your feelings, you're checking in, they can tell you little tweaks about what they do or don't want, and you can be more aligned. Right. And so feedback is really what allows clients to, like here he wrote, right, have clients stay in therapy rather than drop out because they don't feel like they have to avoid or complain to their friends. They'll talk to you about it. And I always tell clients in the beginning, by the way, at some point you might feel annoyed by me or irritated by me. When that happens, that's a good sign. That means we have a real relationship. Here's the one commitment I have to you, and I want you to give it to me, right? Could we both communicate if something is bothering or confusing or irritating? Like if you're mad at me, I want to know. Just because if you don't want to continue with me, that's fine. But I want to at least be a person that you could communicate about things that are uncomfortable. And I'm going to do my best to be that person as well. So it's just even making one small shift. And usually when you have the hard conversations, they can stay or you lead them to a different treatment. So you see improved clinical outcomes, right? Instead of staying the same or getting worse. And there's less complaints, by the way, because it's kind of like relationships. When you check in with your partner, hey, babe, or your kid, consistent check-ins, not too much, but a healthy amount, there's an open conversation. And clients want to know, how do I know if I'm doing this right? How do I know if I'm doing better? Are you tracking this? So briefly, just to wrap up, and then I want to check in with any of you. What we want to do is we want to shift from feeling frustrated. I know my own self times that I felt lost, frustrated, confused, to feeling more empowered and fulfilled. And like I said, it's a parallel process for our clients as well. The clearer we are, the more confident and humble we are, the better we'll lead our clients to feeling like they're getting the most out of their therapy. What I want for therapists, just me as a therapist who for years reached out to, peer groups and consultants around the world, and I'm an EMDR consultant. I'm actually writing a book with New Harbinger in EMDR, and I'm a sensory motor therapist, 3-year sensory motor training and 2 levels IFS. I just felt like I needed good consultation. And so I created, besides for my group practice, a trauma training program for therapists to get a lot of knowledge, like I was showing you the back end before, where I go through attachment dynamics and some of like the primary neurocellular patterns to use with clients on a somatic level, some psychoeducation, really deepening work, parts work. And then there's also live consultation groups that we have with therapists where I give you clinical consult on your cases right now. So you get clinical support. I teach you the skills. There's a video aspect and then there's a live aspect. And what we found, right here, I have it right here, is I have a consultation group that I run for therapists where we meet twice a month. And then twice a year, I run this trauma therapist cohort where we're accepting applicants right now for our January cohort, where we have therapists around the world. Really, the best part, I think, is like people supporting each other. There's like a community piece, and then there's just clinical expertise that gets nourished and developed. So I'm so glad that you're all here. I'm curious for any of you if you have questions or comments. I'll be hanging out here for a few minutes. And I would love to hear how this was for all of you. I really, really value feedback. So I'd love to hear just how this was, something that you might have gained or something you're getting a review on. Zlatka, I'd love to hear, how was this for you? Thank you for being here.
Yeah, thank you very much. This is great. This is wonderful. As you've mentioned at the beginning, the work we do is challenging.
Yeah.
Okay. And it's case by case. So the more we extend our knowledge, understanding on our end, I think, yes. I mean, knowledge is power at the end of the day, no? And just kind of for us, we become more powerful and our clients as well. So thank you very much for this workshop.
Yeah. I think also, if I could just say about how this work is challenging, I think one of the things I also would hope that you can walk away with, where I mentioned it briefly about the frame, is also knowing how to manage our own energy. If we're starting to feel depleted, or if we're noticing that maybe we are like, sometimes we're leaning in session, like we're almost doing more of the work, or we feel like we're carrying a lot of emotional energy, noticing that for ourselves, because it's like, wait, hold on, like, how can I do work here that is sustainable? and that's healthy and balanced for myself as well, right? Like we can't forget ourselves, right?
Yes, yes, that balance is always the challenge, no?
Yeah, yeah. Holding that in
The
mind.
excitement and the excitement
Yeah,
is
yeah. It's like the excitement and the challenge, right? And there's the humanity there. Yeah.
thank you. Thank you very much.
Be here. Fiona, how about you? What are you taking away, or what do you?
Oh, so much. My hand hurts from writing, but I think for me, the stuff about the therapist being the vessel and how much more work needs to go into the self-care, the connecting up, the consultation, than perhaps is totally necessary for other work. And that's definitely something I'm going to be taking back to my team.
Yeah, awesome. I love that you said that. Well, essentially, it's like the parallel process. And people always say, I want to do trainings for my clients. I'm like, sweetheart, I've done trainings for me. And it happens to be I do amazing work with the clients, but it used to be I'm coming for clients. Then I realized actually this is me filling me up. And then as I do that, I'm like naturally able to give you. But let's not skip over ourselves because then we start not feeling so good. So I love that you're taking that with you. Jocelyn, did you just join? Okay. You want to just say hello and where you're from? And I'm curious.
Hello, by mistake, because I thought it was at 3 o'clock, but I see it was at 2. So that's so I'll listen to the recording then.
Yeah.
But yeah, I will admit I'm not a therapist, I'm a psychiatric nurse. And so I deal right on with trauma, and I'm working toward becoming a trauma-informed expressive art therapist. So for some reason, I stumbled on your work, and I felt very compelled to be attracted and everything. I was even wondering if you could open that to extend that to even other people besides just, people who are licensed therapists. I don't know.
We have had like a psychiatric, like a physician's assistant and a psychiatric nurse practitioner. I'm
Uh-huh.
happy to chat with you more about it. If you are directly working with clients and you are incorporating trauma-informed care, so you're actually like being able to use some of the knowledge either from a psychoeducational standpoint,
Mhm.
I'd be happy to see if like I can support you in that.
I'm
I
not a practitioner. I am an RN, and I don't want to say just an RN because there's no such a thing.
I love that you're owning that. But I love that you're becoming expressive arts. That's huge for trauma and for the nervous system.
Yes.
Wow.
Yeah.
How
So,
far are you in your schooling? How much longer do you have?
well, I'm with Dr. Kathy Malchiotti.
Hmm.
So, I think I've done other work before, but some school are not accredited to be certified to be able to go with the registration. So really, I'm restarting over. So I'm with Dr. Malchiotti. I think I have 5 class under my belt. So
That's
yeah.
exciting.
So and
Yeah.
I learn a lot. So
Wow.
I'm very into trauma to heal
Yeah.
my own